I'm a professor from Shanghai Jiao Tong University School of Medicine. And I think I really like research. I really like to turn some interesting things or dream some big ideas into the reality. I think it's a great recognition for my scientific work, especially in the field of in vivo Raman imaging. And I think personally, it gives me a big encouragement for me to find more innovations in the imaging field. And professionally, I think it also shows our imaging technology is getting more attention, and it gives me more confidence to collaborate with clinicians and engineers to advance our technology further. Traditionally, the Raman imaging can only enhance signal relies on the gold or the silver substrate, so it can mainly used for in vitro diagnosis. Actually, our group previous the key discovery is we find a kinds of small molecules. They no need any substrate. They itself can elicit very strong signal, so it make the Raman imaging can do in vivo. I think that's our previous main work. So in the future, when we want to really keep this forward, we want to answer two key questions. The first is whether we can find more structure diverse small molecules to work in vivo. And second is whether we can put these novel imaging technologies to really benefit the clinic, the diagnosis and treatment, and finally we can really benefit the patient. I think for me, the biggest driver is my diverse, my cross-field education and also collaborative experience. So for me, actually, my education, my bachelor is pharmacy, my PhD is chemistry, my postdoc is kind of biomedical engineering because I'm doing in Harvard and MIT. So, for example, for the Raman imaging, actually, traditionally, it's just a chemical tool. But when I was thinking this, I want to turn it into a clinical tool. So when it goes clinical, we should think different. We should think whether it's safety or not, whether it should be translationable. That's why I started to question this traditional in vitro diagnosis field of Raman imaging. And then I think that's how I can question this field. But actually, our key discovery is totally comes from our collaborative research, and our collaboration actually is a happy accident. Just my collaborators give me some sample. I think it's a negative control, but the negative control elicit very strong signal. This accident actually totally changed our main discovery, so we explored the reason and finally we got the big discovery. So I think the cross-field education and collaborative research is very important for me. I think I'm still young, but I know there's more young generations. I want to share is we should think big, we should dream big, but we should also work solid. The first dream big, it means we should not just dream some fancy idea, but we should really dream some important things. For example, we should think about what's the real clinical need, what's the real national needs, what can really benefit people. So let's say we dream big. At the same time, we should respect those we already know, but we also do not afraid to question some some weird things. For example, there's some weird happen. Do not afraid. You just explore what's the reason why. That's it. And finally, I think it's very important to build a solid academic skills, because sometimes even you find some new things, you need to explore the main reason. You need to know why it happens. So all this rely on your solid knowledge and skills.